A story that we've been looking into at Here and Now about your health. How long is too long to wait to see a specialist? You know you worry about it. See specialists are a lot more common here than you might realize. Deanne's series is called No Relief.
You often hear of cancer and surgery waiting lists, but there's a slew of specialists with wait lists who rarely make the news. They treat everything from Parkinson's disease to diabetes, arthritis to hereditary. Dr. Julia Trahi is one of the youngest general internists here. Other doctors call her specialty medicine because when they don't know what's wrong with you or how to manage it, they send you to Trahi. It's her job to figure it out. She spends half her time seeing people other doctors refer. The other half is spent in 2-week rotations in hospital. She's on call then, 24 hours a day, 14 days straight. How does she feel at the end of that?
The stress is off my shoulders. I want colleagues. I want help. I want to know that my workload's going to be reasonable because the job is so important that you don't want to make mistakes.
There's supposed to be 24 salaried specialists like Trahi just at the Health Sciences and St. Clair's alone. There's only 18. The shortage of specialists is why you wait so long. To see an internist like Trahi takes 9 months.
Should have been seen in 2 weeks, 2 months. Or is it something, I don't think anything really is appropriate to wait as long as 9 months to be seen.
Parkinson's disease, stroke, dementia. For trouble like that, you need neurologists like Dr. Alan Goodridge. Goodridge constantly juggles and prioritizes his patients to stay on top of the most pressing need. His wait list is 1 year.
There's a higher risk of people slipping through the cracks when we're sort of all working at and beyond our capacity.
There's a 50% chance you'll see Dr. Bridget Fernandez if you have hereditary cancer or other hereditary illness. The province only has 2 specialists in this field. Pregnant mothers always top her wait list, but after that?
Semi-urgent, which is seen within 6 months. Which semi-urgent 6 months is kind of long. And then the non-urgents, they're, pretty much 3 years. Because it does seem like, gosh, how are we ever going to get out of this,
They all worry their patients suffer irreparable damage during the wait, but Dr. Sean Hamilton knows it's happening for sure, all the time. People with inflammatory arthritis should see a rheumatologist like him 6 weeks after they're diagnosed. Permanent damage starts at 4 months. His wait list is more than double that, almost 10 months. For non-urgent cases, the wait is 4 years.
Patients that don't get seen early enough don't get the necessary treatment, and therefore will go on to develop joint problems that are long-term.
And that's only for this group. There are wait lists for endocrinologists, respirologists, psychiatrists, urologists. The list goes on and on.
And so there's always this struggle between, oh my God, the wait times are getting so long, but yet a fixed number of people really can only do so much work.
How much should you worry about this, and how bad is it going to get? The doctors will tell you, coming up next, right after the break.
Welcome back. Most of you know how it feels to have yourself or a loved one on a waiting list. There's not much relief from the worry, discomfort, and sometimes even pain. But for the specialists who work long hours to whittle down those wait lists, there's not much relief either. Here's Deanne Fleet with part 2 of her series.
Dr. Julia Trahi was scheduled to be on call at the hospital the day she gave birth to her daughter. It's a sign of how desperate the medical system is for specialists here. Now her daughter is 2 years old, and most days this general internist gets home after her children are asleep. She works weekends too. That workload hit her in the gut recently when her daughter asked why Mommy doesn't live in the same house.
And she just assumes that I live somewhere else and that I kind of visit here. And that has been, she's 2, that's her experience.
For Trahi, there isn't enough time. Her children will only be little for a few years. But she can't slow down because her patients will suffer, may even die, if she doesn't plow through a growing wait list.
You know, I want to do both jobs well, both as a mother and as a physician. And I have to make a choice. And more often than not, in fact, I choose the work because, well, I can defer to my husband to look after the children while I'm at work. But part of me really feels that, you know, there needs to be a better balance.
Trahi's choice is common. Wait lists are so long now, many specialists feel there's not really much choice at all.
For most of it, it's probably a job and a half or more in terms of the span of a week because of the demands.
Well, the volume of referrals, just for as an example, has increased by 4-fold in the 10 years I've worked here.
How serious is this? Some specialties teeter on the brink.
We actually can't keep that service safely going. The loss of just one physician and the whole thing, house of cards, is going to crumble in our instance.
Other specialties have gone over the edge. 10 years ago, Dr. Sean Hamilton had 12 dedicated hospital beds to treat his most severe patients. Now all those beds are gone. He must fight to get people admitted.
Most times they have to come to the emergency department. Which is not the appropriate place to admit patients. They can't even brush their teeth. They can't even walk across the floor or whatever. They're really debilitated.
Hamilton used to offer a day program with a team of physiotherapists and the like. It's gone too.
If you're working in a practice in which you know you can do much better, and you can't do it because your resources don't allow it, then it is very frustrating.
Specialists in these fields have come and gone here over the past decade, but for the most part, their overall numbers have not improved. That's even with new graduates from the medical school.
If you're waiting many months for a test, it can interfere with the quality of your life. It interferes with the ability to work and do other activities. In other cases, it's anxiety. The possibility of something like multiple sclerosis is raised. There's a tremendous amount of anxiety about that until the answer's been addressed one way or the other.
Something needs to be done because we cannot keep going down the road we're going without there being negative outcomes.
For the doctors, there's a simple solution. All Julia Trahi has to do to get a more reasonable workload and more time with her children is move. She get double the salary too.
Every day I'm getting inquiries from elsewhere. My first choice is to stay here, but if things continue as they have essentially for the last 10 years, particularly in general internal medicine, I really have to look at my children and say, well, this is also their lives too.
Every one of these doctors is from Newfoundland. Their families are here. They all want to stay, but they're not sure how long they can wait for more help.
As much as we really love the province, the job description just becomes so onerous for, you know, the number of hours that you have to spend, difficulties with hospital infrastructure, and at a certain point to which it's really different for every person. It just doesn't, the trade-off isn't worth it anymore. The salaries have been allowed to become so non-competitive that, to expect anyone that didn't have domestic ties to come here and do this degree of work with this degree of under-resourcing, it's just not realistic.
What's it going to take to attract more specialists here? The doctors say the biggest issue is money. Now they're waiting to see if the Williams government understands that how long you wait depends on how it deals with their workload. Deanne Fleet, CBC News, St. John's.